Year over year, people will experience real improvements.
Minister of Mental Health and Addiction Sheila Malcolmson announced Wednesday morning that $132 million will be invested into substance use treatment over the next 3 years.
This investment will create more than 65 new or enhanced services throughout BC. It will add more than 130 full-time staff and open an estimated 195 new substance use beds for adults.
Vancouver City Councillor Jean Swanson says it's a good investment but fails to address the daily deaths from a toxic illicit drug supply.
They're talking about more treatment, which is fine, that's good. But the problem is that it's not going to save people who are dying from poison drugs. A lot of the people who are dying aren't addicted. They're occasional users. So they need to be able to, they need to either not do the drugs or get safe drugs.
What was announced today indicates to me that they're going to let this continue.
Drug policy consultant Karen Ward thinks the BC government is missing the real solution by focusing on addiction.
Focusing on addiction makes it about individuals. But when you've got 2,000 people dying a year, preventable because of policy choices, that's political. And that's what they're avoiding doing.
Advocates for drug users say that safe supply is ultimately what will help save lives every single day. Last week, Vancouver City Council unanimously endorsed a local drug advocacy group's application to be exempt from the Controlled Substances Act. If the government gives them the pass, this group would be able to legally acquire, test, and give out drugs.
Right now, we use a dark web to purchase drugs because it's the safest marketplace for us to do so, but we don't even want to be purchasing the drugs illegally. We want to go through licit pathways.
Eris Nix is the co-founder of the Drug User Liberation Front. They buy illicit drugs, test them, and give them to users. This is what the group calls the community club model, which Vancouver has endorsed. Compared to the province's current safe supply model, you would not need a prescription to get these tested drugs.
Here's the thing. We don't want to break the law. To not break the law, you have to prove that the project that you want to do works. Right? So we have to break the law to show them that the project works. Again, of the 100 grams of drugs we've given out, there have been 0 overdoses, fatal or non-fatal.
Last year, Vancouver was the first jurisdiction in Canada to apply for federal decriminalization of simple drug possession. Councillor Swanson says the city has created a lot of momentum for this movement.
I mean, I hope the feds respond in a positive way. I mean, it's what needs to happen in order to save lives.
In Vancouver, Kier Junos, City News.